my name is Gabriela Chavez. I am a graduate student here at Bloomberg in the Department of Health Policy and Management.
Where did you study during your undergraduate education?
I did my undergraduate degree in the University of Illinois in Chicago in computer science and applied statistics.
Are you part of any student organizations here at the Bloomberg School?
Yes, I am. I am part of the leadership board for the Latino Public Health Network and also the Artificial Intelligence and Public Health Society.
What does the Latino Public Health Network do? Is it like a kind of affinity group bonding kind of thing, networking?
Yes, it is a networking. It's also, I guess, a place where other Latino kids in nursing and the medical and public health just get together, and we do community outreach, we volunteer, we do network, we do alumni events, stuff like that.
Cool. What are your current research interests and what motivated you to focus on those areas?
Yes, my current research interest is in aging populations and just health disparities in marginalized populations and vulnerable communities. What motivated me? I worked previously coming to grad school in a nonprofit for 4 years where we worked with a lot of the South and West Side part of Chicago. So really worked with the community. So I saw a lot of disparities firsthand and just came here to try to make a change.
Do you have a personal connection to the research you do?
Yes, this is kind of like a personal mission for me. I'm making a career change from computer science coder to now health policy and management. I would say my biggest motivator is my mom. She passed away, and during her, I guess, healthcare journey, I was her caregiver, and I really saw the healthcare gaps for seniors, especially marginalized population patients. So I'm here and I just want to make a difference and just help out other families like my own.
What does your dad think of your career path?
My dad is extremely proud. I am the first in my family. I'm a first generation, but also the first in my family to get a graduate degree. So there's a lot he doesn't understand, but he's very, very supportive and just really proud that I'm here to want to help out the communities.
What is the Health Quality Forum and what was your experience like attending?
It was a very insightful experience. It's a forum where different states come together, different stakeholders, policymakers, techs, epidemiologists come together and really just strategize and talk about best practices to advance health equity. I was one of 2 graduate students from Hopkins that had the opportunity to go. So it was very insightful just hearing what other states are doing compared to Maryland and Illinois. So it was very refreshing to hear everyone wanting to advance health equity and just how their recommendations and their best practices and how it's been working out in their state.
On your LinkedIn, you mentioned that 2 quotes from the forum stuck with you. One was, "There is no quality without equity," and the other was, "We cannot lose sight of the collaborative dialogue as the foundation for change." Could you talk about why these particular quotes resonated with you?
Yes. I would say the first quote, "There's no quality without equity," is very personal to me because we can't improve quality without first making sure that everyone has accessible healthcare for everyone, for all populations, even the hard to reach. So I really, really like that quote. The second quote really resonated with me as well because when advocating for different policies, you really need to have collaborative dialogue with everyone, just making sure everyone listens. We all listen and just collaborate with each other and try to understand each other's perspective to really advance healthcare and quality and just equity.
Do you have any mentors and how have they shaped your journey?
I have a lot of mentors, but I would say the main one that comes to my mind would be my old supervisor. Right now he's working in DC, but he was kind of the reason why I knew about Hopkins in the first place as a first generation. When applying to graduate schools, he mentioned, "Oh, you should apply to Johns Hopkins," and that's literally how I found out about this university. So very grateful for him and always him just believing in me and really motivating me to think outside of the box.
Was he a professor of yours at your previous school?
He was my old supervisor back at my nonprofit at Chicago. He was actually the one who hired me straight out of undergrad, mentored me, and then was very supportive when I decided to go for my master's, and he was, looking at schools with me and suggested I apply here, and here I am.
Shout out to him.
Shout out to Ted.
What would you say to an undergraduate student considering a career in public health?
My advice is stay true to who you are. And if you have a vision, definitely work hard for it, because maybe not everyone might understand your vision, but as long as you can understand it, definitely keep working hard for it.
When you're not working, what do you like to do to decompress?
Ooh, currently I de-stress by teaching myself how to play tennis. So me and my friend bought some tennis rackets from Amazon, so we've been playing in Patterson when it's really nice out, and yes, running around.
Nice. I also remember you mentioning you were into boxing. Is that still a thing for you?
Yes, I used to be an amateur boxer back in the day. Now I'm currently doing it as a hobby, still not as consistent, but yes, that's also another way that I personally cope and de-stress.
Last question. Do you have any book recommendations? Either a book you've read for fun recently or something related to your work?
Ooh, I think, there's a lot of good books, but I would say my number one favorite book is still The Alchemist. I think it's a nice short read that just tells a simple story about the purpose of life. So definitely a really, really good read.
And those are all the questions I have for you today. Thanks for taking the time to chat with me.
Of course, thank you.